Good morning, good afternoon, good evening to all. Thank you for joining us today. I, Aishwarya Jain, a research coordinator and youth ambassador at GCTC, welcome you all on behalf of the GCTC family in our Manthan Series 2021. I would like to thank our patrons, Executive Board, Executive Council, and the Advisory Board for their constant support and guidance. For those of you who do not know much about GCTC, I would like to take a minute to introduce it. GCTC, or Global Counterterrorism Council, was established in 2016. It is a global think tank which provides a platform for brainstorming and thought-provoking discussions on issues ranging from national security to international relations. Over the years, GCTC has grown as a family of 450 distinguished luminaries from across the globe. It has 6 international chapters working on the core issues of national and international security. Besides, GCTC has been constantly working during the COVID times, and GCTC Manthan is one such effort. GCTC Manthan was initiated last year during the lockdown to provide a platform for people to connect. It is a series of webinars to encourage informational discussions and deliberations on the current events. More than 100 webinars were organized the last year. And looking at the success of it, we have once again come up with Manthan Series 2. Today, we are here to commence it. 2 sessions are scheduled for today on the topics Rethinking India's Healthcare Infrastructure and COVID-19, Present Scenario and Future Pathways Global Perspective. As we all know, COVID-19 has claimed more than 1 million lives in the past 2 years, and it continues to create havoc both nationally and internationally. It is an infectious disease which is caused by the SARS-CoV-2 virus. SARS-CoV-2 virus was named so because it was first responsible for the SARS outbreak in 2003. Being an infectious disease, as per the World Health Organization, it spreads through the respiratory droplets of the infected person, even by touching the infected surface. Its symptoms include problems in breathing, and also in certain patients it gives fever and cold. As we all know that India gave a tough fight to the first wave of COVID. In fact, India helped or assisted the other countries in fighting against the COVID infection. We supported the other countries by exporting hydrochloroquine and also other medical supplies. But the second wave has hit India badly. There has been shortage of oxygen concentrators, because of which people were losing lives. Now, though, India is handling the conditions satisfactorily, and also the other countries are assisting us in doing so. The second wave is creating such a havoc because it is caused by a double mutant strain. As per PGI-MER's recent research, it is this double mutant strain which is also declared as a variant of concern by the WHO. Thus, the current situation presents a need to deliberate on the probable impact of the coronavirus on India as well as in the world. Now, with this, I would like to introduce the speakers for today. For session 1, which is on rethinking India's healthcare infrastructure, we have with us, the session would be moderated by Kartikeya Sharma, who is currently the executive editor at TV9. For the speakers, we have Dr. Shekhar Dutt, a former IAS, Sena Medal awardee, the former governor of Chhattisgarh, former health secretary and defense secretary for the government of India. We also have with us Vivek Krishna Tankha sir, who is currently a member of parliament serving in the Rajya Sabha representing Madhya Pradesh state. He is a senior advocate working with the Supreme Court of India. We also are honored to have with us Dr. G. Satish Reddy, who is currently serving as the chairman of DRDO and the secretary of Department of Defense Research and Development. We also have with us Lav Verma sir, who is a retired IAS officer who has served as a former secretary of Department of Health and Family Welfare. Then we have Professor Nirmal Kumar Ganguly, who had been the former Director General of Indian Council of Medical Research. Also, he is a Padma Bhushan awardee. We also have with us Dr. Nimesh Desai, who is currently the director at Institute of Human Behavior and Allied Sciences based in New Delhi. Dr. Jayalal, who is currently the president of Indian Medical Association. He is also the vice president of Commonwealth Medical Association, London, and the national coordinator of IMA at UNESCO, representing the country at UNESCO. We also have with us Dr. Rashna Khanna Singh ma'am, HOD of Holistic Medicine, Artemis Hospital, Gurgaon. Now, with this, I wish all the viewers a very happy journey sailing with the distinguished speakers and having a great learning experience in the next 5 hours. Thank you. I would like to request Mr. Kartikeya Sharma to take over from here.
Thank you. Aditya, first of all, I must thank you for inviting me to moderate such an eminent panel. You know, it becomes very difficult for even TV channels to get hold of people from such different expertise, such depth of experience which they hold in terms of administration policy and in terms of what should be the future implementation of policies which are always in making when it comes to pandemic, or or a situation in making with which India and the whole world is grappling with. Because for example, even in the world of medicines, we know that what we think is correct today or the right treatment protocol today may not be after 6 months. And this is something with which the humanity is grappling with. So I thank you, all of you, once again, that you have shared precious time from your schedule, and you have chosen to be with us. So thank you, Aditya, and thank you, Global Counterterrorism Council, for inviting me. So first of all, I would like to invite Dr. Shekhar Dutt, former governor of Chhattisgarh and former Health and Defense Secretary, to share your insight on the issue of rethinking Indian healthcare infrastructure, because this is one issue, sir, with which India is grappling, and you must have witnessed, seen, even participated in social media as to how, if I may use the word divided, or if I may use the word conflicting opinions are as to how prepared we were, or what could have been done, or what should have been done, whether we were ahead of the curve or not. So I would like you to address the issue of reimagining the infrastructure. Did we do enough, sir, of reimagining the infrastructure for post 2020, when we realize that this is going to stay with us?
Thank you very much, Mr. Kartikeya Sharma, and good afternoon to everybody, all very eminent people, all my colleagues of early years when I was working at various institutions. It is extremely important to talk about this issue, because I think healthcare has to be one of the most important objectives and work of any country. And I would always say that, unlike what people think, that health is or expenditure on health is an expenditure, I would say expenditure on anything about health is an investment. Because after all, unit of the country is its people, and the people have to be healthy. People cannot be healthy if the health infrastructure is not good. Health infrastructure is not necessarily only hospitals or only large research stations or pharmaceutical organization. Health infrastructure would mean providing health cover right from the time when a new citizen is born in the country. And from that time onwards, the country should be able to provide the necessary infrastructure, so that it is not to provide hospitals alone, the infrastructure whereby the health of the individual is taken care of. The health of the individual depends upon many things, and some of the most important things are that at the local level where the family is, there should be certain infrastructure which should be available for treating or diagnosing any problem that the child has, and that is extremely important. So we have the basic layout, but the point is that is the basic layout good enough in today's context? We have got the primary health center, we have got CHCs, community health centers, we've got district hospitals or subdivision hospitals, district hospitals, and then we've got referral hospitals, and we've got certain extremely good doctors. I have seen doctors at the remotest corner of India where a government doctor is posted, and when you talk with him, you find that he is an outstanding person because he or she might be just a single doctor available for a community as large as 50,000 people, and he or she understands the needs of the family. Many times I found that if I go for seeing a flood hit area and I go to a particular place and I find that the only chap who can take me along to the different villages which has been affected is the local doctor. Why? Because the local doctor goes to those villages on call, and he knows the route. I piggybacked on him on his motorcycle, and went to this place where lot of other people were not able to go after a dam burst incident. Now, I would say that it is necessary to strengthen from that level, from the PHC level, we must strengthen, and the basic health care should be there. It is also necessary, ladies and gentlemen, it is also necessary that we as a country should have good health as individuals. If you know, and we will be hanging our head in shame, our life expectancy is lower than Nepal, Bhutan, Bangladesh, and Sri Lanka in South Asia itself. What to say of the broader East Asia or Southeast Asia? We are lower health expectancy, life expectancy than Nepal, Bhutan, Bangladesh, and Sri Lanka. Every citizen of India should have a health expectancy which is above the average of the world, and much above the average of Asia. And even within the country, the life expectancy of Kerala is almost 12 or 14 years higher than the life expectancy of some of the northern states. Now, that shows that there is something wrong. We have to start off from there. We have to have infrastructure where doctors are there in the hospital. Even one or two doctors in primary health sector is good enough, because there are other healthcare people, and the other healthcare people ought to be there. The local DAI will have to be trained for providing the initial service to the newborn. So mother and child has to be protected. The more we do that, the more immunity comes in that body. I was Director General of Sports Authority of India for 3.5 years, and I have seen how difficult it is to get medals because our athletes don't have the required stamina. We train the athletes very, very strongly for preparation of Commonwealth Games at Manchester and Asian Games at Busan. And you will be surprised, we got the gold medal of women's hockey, although we didn't get the gold medal for men's hockey, but we got the gold medal for women's hockey, and every member of the women's hockey team was anemic, except the goalkeeper captain who was from Manipur. Every member of the women's hockey team was anemic. Now, how can you have the best players, all of them anemic? Why? Because women are not given the same diet as men, or boys are given higher diet, and the girls are left to eat later. And but even then, we have had PT Usha, we have had other good athletes from women. Now, what I mean to say is that we have to start from the childhood. We have, then only it is possible to have the entire immunity. My father was a scientist, and he was involved in a lot of things which ultimately actually became a department called immunology. And immune systems of the body itself is a result of enormous amount of building up right from the beginning. Right diet, right water, and right kind of health practices. All these things. Now, health practices must be part of our education system right from the beginning. So, health institutions at the village level or the PHC, then health institutions at the community level, then the subdivision, and the district hospital should be a referral hospital. My sister was born in a district hospital, and at that time, in the 1950s, the district hospital was good enough, as good as some of the private hospitals that you see. Why? Because the doctors were given that kind of samman, that kind of institutional honor, and the doctors and the district hospitals were there. In Uttar Pradesh and many other states, the district hospital itself have a campus, have almost everything. We, the government, have to ensure that they have the budget, they have the minimum amount of equipment, testing things. Health has to be taken as a investment, and do not ever think any expenditure in health is an expenditure. Any spending in health is an expenditure. If that happens, our country will. I was defense secretary, and I was 4 times in the Ministry of Defense, and I was also a officer in the Indian Army, having fought the Pakistanis. I know every time we say that there are lack of officers in the Indian Army. Why? It is not because people are not willing to join. It is not because the testing facilities are not there, and or training facilities are not there. It is because the test of people to join the Indian Armed Forces is very rigid. It is both physical, mental, and psychological. And all these tests results in people like 1,000 people appearing, and perhaps only 6 people being found fit to join. I as the governor of Chhattisgarh, or Madhya Pradesh, we started recruitment of large numbers of people to recruitment camp.
Okay.
Here also we found that there were very tight selection process, and many more people got rejected mostly because of health reasons, even psychological, even the presence of mind, that also gets affected if your body does not have some essential parameters like reflexes. The reflexes become slow, and we cannot accept any lower standard in the Indian Armed Forces. Now, my point is that we have to make the unit of the India, and that is the people, the person, the individual of India, men, women, boy, and girl, must be good in health. And that is what has to be done. And we have to have good medical colleges are there, very good doctors are getting trained. We must see that those doctors are employed and properly, and also we must have large scale of provision We got the fourth largest pharmaceutical industry. We have to have new molecules, new medicines, because India is a veritable world. Whatever is happening in the world has already happened in India. Or if we prepare ourselves from the knowledge and experience that we get from India, we will be able to do wonders. So the thing is that our infrastructure, as far as the knowledge of infrastructure is there, we have to man it, we have to women it, we have to put trained thing, we have to have the equipment. It is not just X-ray machine. There are so many other things which has to be available in the district hospital and even in the subdivision hospital, because our subdivision or a tehsil headquarter has more population than the district population of a European country. So it has to be seen from the point of view of how many individuals are serviced by how many medical personnel. And we have to have that. The private health infrastructure will do the work for those people who can pay for it. We've got one of the largest poor population of the world. We have to actually sort of take care of that, and we will do that. And inshallah, we will have the kind of services for our youth and for our citizenry. Thank you very much.
Thank you very much, sir, for sharing your insights. Now, I would like to invite Professor Nirmal Kumar Ganguly, former Director General of Indian Council for Medical Research. And, sir, I would like you to share your perspective in context of the healthcare infrastructure. And in your opinion, what needs to be done so that we remain pandemic ready in case, we have more such similar waves in future.
Very much for this opportunity, Dr. Mr. Shekhar Datta and Mr. Tikku and all others. I will like to visit the past and say that India made some very right kind of a decision, but somewhere those decisions got lost. And how do we revive those decisions and make India strong in place for the healthcare? So I faced around 11 major epidemics and about 5 or 6 pandemics. And every time we got paralyzed. And my first experience was, this is how it was done, that our CDC was actually charged with controlling, in fact, diseases. And it actually did that. But about 2 or 3 diseases, it played a stellar role. It played a stellar role for smallpox. It played a stellar role for halving the malaria. And at one time, got malaria under control. It controlled yaws. It did so many things, and it was a very strong structure. Then plague struck. And by that time, our Indian CDC was paralyzed. It didn't have any structure. So at that time, the then health secretary brought out Dr. Ramlinga Swamy from retirement and asked him to solve this problem. So what did Dr. Ramlinga Swamy did? He called me from PGI. I was in PGI Chandigarh. Then he called me Dr. Batra. He was in the DRDO Gwalior. And he assembled 4 or 5 people to whomsoever he found were capable and said, let us investigate. And in spite of a strong opposition and strong things, we could show that it was a plague. And then Dr. Ramlinga Swamy and I was part of that committee. We thought that we will strengthen NCDC. So that at that time it was not known as NCDC, that we will strengthen Indian CDC. So at that time, Mr. Chaudhary was the health secretary. There was a totally independent committee was made. There was no government officials in that. And it was envisaged that we will build a CDC, which will be autonomous, where the director will be of a very eminent person, and it will really serve as the US CDC serves. So the building came up, some instruments came up, but the other part didn't get into operation. So we need to strengthen these structures, and this is one of the important structure for this. Then we had one Director General of Health Services, his name was J.V. Srivastav. J.V. Srivastav envisaged that there will be public health laboratories all around India. In every district, there will be a strong public health laboratory system. And there will be a public health network in India, which will take care of that. This will not be the doctors and others, but it will be scientists, engineers, public health people, and everyone. That particular recommendation was there, and I don't know where it went. CDC have a network of laboratories, but those laboratories have not come up. The other thing, which when H1N1 struck, then Mr. Obama did a stockpile of the materials which we need to stockpile. And he stockpiled everything. And the method in stockpiling is this, that if they expire, you throw them. But at least you save life when the time comes. So that particular part we haven't done, and we should do, and we should really do that. Another thing was this, that if we really see our pharma sector, our IT sector, and our vaccine center came up by themselves because of the whether it was public health need, or whether it was commerce, or whether it was a vacuum which was produced around the world, they came up by themselves. And there, when H1N1 came, we gave the vaccine companies quite a good amount of sum to make influenza vaccine. They made influenza vaccine. We didn't use it. So, and we lost an opportunity of moving that for adult vaccination program. Today, we have to do an adult vaccination program in a very big way. At that time, there was the health secretary, Mr. Saxena. I had just joined the structure, and I was asked to scrap the NIB. He said that it was 16 crore project, it has become 64, it is now 456 crore project. So see that whether we can close it or not, there is an administrative building that should take care of that. So some or other I convinced him, and then he took opinion around the world, and everybody said we need to have that. And he then called me and said, now you have put me in this mess, you build it up. So we build it up. It is one of the beautiful structures we have in the country. It was like NICET, SIBA, and today where it should have validated all the test kits and other things with a very, very neutral path of way. I don't know where it is and what role it is playing today. So we need to really strengthen our infrastructures. In the same way with Dr. Mashelka, we created a strengthening of drug controllers office. And there, you know, the drug controller every place is a very high person. If you really look at that, they have a profile where people envy them and people listen to them. So we got a building, we got a structure, but that drug control, that Mashelkar recommendation could not be implemented. So what I will say that we strengthen our available infrastructures at least. If we really strengthen them, they will play a role for which they were meant. The second one, which is very, very important, we need to have quality. The quality is very, very important. Our quality has gone down because of many reasons. One is commercialization of the health, and second is our own methods. I joined PGI at which time 25% people used to go away. Everyone prospered, and 25% new people came who were pioneers who tried to set up the structure. We had Dhar committee. So these All India Institute, PGI, etc., which were temple where every post was for a quality person, and we fought about it, and that went out of a drain when one got promoted. Same thing happened in the health infrastructure, central health services. 50% were from outside at one time. Then it became 25%. Now none. And some or other, it is a very unfortunate thing that from in my time, Dr. S.P. Agarwal was there. He was very, very good. We competed and we actually argued and did everything but we could work together, and he could advise the health ministry appropriately. So there was a strong health directorate and there was a feeder group from which it came. But now we need to strengthen that, because I am not seeing during this pandemic any health directorate anywhere in our system. Finally, we in the polio, there are 2-3 points more I will make, and one point is this, that during the polio there was an external committee of advisors. What I did when I was ICMR DG, I never chaired any ICMR meeting because I needed advice. If I see and say I want this and this, I have opinion on everything, people will not express their opinion properly. So the same way, when I was asked by Mr. Prasad Rao to set up NTAGI, I set up NTAGI, but I didn't become chairman of that. And nor Mr. Prasad Rao sat there. So, but some or other it changed characters in between. So the advisory boards, and the same thing was in the polio, there was an external advisory board. Health secretary and everyone sat around the table, and this could really advise the government very, very nicely. And the chair was Mr. Datta, who was past NCDC, played a very important role in polio, and government got good advice. So we need to structure our systems who give advice to government in a way which you get a real good advice, and you don't really have conflict of interest on those systems. Finally, one of the things which I did, that I gave ICMR, at that time, everything actually got in place. The cabinet secretary was my class fellow, Mashelkar was my friend, Dr. Bhan was my friend. I knew Mr. Manmohan Singh, I knew everyone over there, so I could get the department status to ICMR. But I never thought this horror story will come. Like everything, one of the best thing in the governance is the least governance. I didn't know that everything, when a health ministry will take a sideline and everything will get controlled, right from the how many tests you do, what kit you need to use, what surveillance data we need to do. And we didn't have a structure like health metrics in the United States or Pittsburgh or the Geo Environment Institute in UK. They actually give the projection, they do the modeling, they look at the data, they crunch the data, and they provide that. The ministry at one time thought about that, and it created a national health portal, a very strong structure, which perhaps could have done that if it had really played its role appropriately and provided those things. So essentially what I will do, India is very strong. It has taken right kind of a decision, but I don't know whether those decisions went. Why those organizations which were meant to be strong got altered, and not got altered without any ill will for anything, without actually somebody obstructing their existence. They just became like that. And what we need to do, I will stop it here. What we will need to do, that we need to correct that. One more final point I forgot to tell, that when the pandemic comes, we need to have a foresight and get the vaccines from everywhere around the world, wherever we get it. And for that, we need to put advance orders. And now we are not getting any global tender inquiry, because industry doesn't work like that.
Okay.
Every time you start manufacturing, if you get an advance order, and so we need to really see, like, our all pregnant women are dying, all. So we need to save them. So we need to get that vaccine, which now can be used in pregnant women from anywhere in the world. That will not be very big quantity, about 27 million doses, because that is what our pregnancy number is, and we should immunize them. So this is the way in which we need to do smart procurement, smart diagnostics, smart surveillance, and work in a smart
Okay.
way and protect our institutions. Thank you.
Thank you, sir. Thank you for making precise observations. Now, I would like to
Mr.
invite Love Verma, former health secretary. And so, my question to you, because your whole argument can be premised on that, is the sort of challenges you face in a federal system and the correction it is required when you deal with a pandemic like this. Over to you.
Thank you. Thank you to GCTC and Adit and Dr. Shekhar Dutt for inviting me to this very interesting and informative seminar today. So just to recapitulate, we have a three-tier system in which the sub-center, the PHC, which is the primary health center, and the CHC, which is the community health center. These are the pillars of our healthcare system, and they are structured around norms. So, for instance, a sub-center is 1 per 5,000 population in general areas and 1 per 3,000 population in difficult, oblique, tribal and hilly areas. Similarly, for PHC, it is 1 for 30,000 population, and in difficult and tribal, hilly and tribal areas, it's 20,000. For CHC, it is 1 for 1,20,000 and 80,000 for the tribal and difficult areas. A new norm has also been adopted for setting up a sub-center based on the time to care within 30 minutes by walk from a habitation for selected districts of hilly and desert areas. These norms were fixed quite some time back, and my first suggestion, the challenge which we are facing is that these norms are actually one size fits all. And my first suggestion would be that there should be decentralization because health is a state subject. So let us ask all the states to do their own planning, and they should fix their own norms and decide where to have their sub-centers, where to have the PHCs, and where to have the CHCs. Already there would be a good deal of infrastructure available, but at the moment what we see is a shortfall across India, and I'm quoting from 2019 statistics. There's a 23% shortfall in sub-centers, 28% in primary health centers, and a 37% shortfall in CHCs. So obviously the norms are not really working. My suggestion would be that let us decentralize and ask the states to decide on their own where they want the infrastructure to be, because too often we feel that we can lay down the norms in New Delhi and that they can be implemented across the country. But that one size fits all policy, I think, has been discredited, and it is time to rethink healthcare from the beginning. Now, my second suggestion would be that on the same pattern as Asha, time that we should similar to Asha's, so that the healthcare of males can also be attended to. Obviously, Ashas cannot talk to males with regard to, say, family planning and so on. So it is very important to have a separate cadre of uh, accredited health activists on the lines of Asha, and we can call them Ashok. Teleconsultation is another big area, I think, which has been thrown up by the pandemic, and it is very important that we now set up these teleconsultation centers so that people in the rural areas who are being diagnosed at the moment by quacks are at least able to access some good healthcare through teleconsultation centers. And there are a number of NGOs and other organizations which have taken up teleconsultation in a big way. What we really need, the policy has also been announced by the government, but what we really need is government and private partnership so that teleconsultation becomes the norm rather than what it is at the moment. It is more of a new entrant at the moment which has not got its due. And finally, I would like to talk about digital health. Digital health, I think, is the way to go for the future. And what we need is that the standards, which have, to some extent, the standards have been adopted, but what we are looking at is something from the womb to the tomb kind of setup where we have interoperable health documents which can be shown at different health centers so that there's no need to carry your bulky health documents and start afresh when you change your health provider. So that is the way to go ultimately. And one more aspect I would like to touch on is the shortage of health professionals, which really comes in when we talk about teleconsultation. There was a study which was done by a US institution in 2019, which said that we need 600,000 doctors and 2 million nurses, which really shows us the size of the problem. And obviously, we cannot tackle this uh, overnight. It is not possible to create such a huge medical force. So teleconsultation will have to be, I think, the way to go for the future. These are the 4 points which I wanted to raise before this August gathering, because what has happened is that if you look at the rural health statistics, which have been uh, given by the Ministry of Health and Social Welfare, the number of CHCs and the number of primary health centers has actually declined in Bihar and also in Uttar Pradesh. So actually, we're dealing with a really obsolete system which has been set up years back and which needs to be looked at right from the start. We need to redefine our healthcare, and these are some of the suggestions I have. Thank you very much.
Okay, thank you. That was very, very precise. That was very precise, concise, and to the point. And some of the observation you made in terms of the physical infrastructure, I think it should be taken seriously by the incumbent government. Now, I would like to invite Dr. G. Satish Reddy, Chairman DRDO and Secretary Department of Defense and R&D. Sir, thank you very much for taking time out of your tight schedule, and I invite you to address us on the issues of challenges and what we need to do in context of India's struggling medical infrastructure. Sir.
Very good afternoon. uh, Firstly, let me thank Sri Shekhar Dutt Sahab, who has invited me personally, spoke to me, and that's how actually have joined in this meet. And thank you very much, Mr. Kartikeya Sharma, for giving me this opportunity, and all the eminent personalities who are present here. My once again namaskars to all of you. One thing is looking at today's scenario in the country, in the pandemic, the way things are going on, and the activities and the way we have been in the last about a month and a half, how the various government departments and everyone and industries have been working together. And similarly, last year, when you look at the end of March 2020, again, when the pandemic has come, the various, again, departments, government machineries, and various teams which have been created, and special powers have been created and given. And then the departments have worked and made things which normally we think that they cannot happen, and the things have happened. To look at the way last year, when you look at it, uh, the PPEs what were being made in the country were about 47,000 PPEs per annum. That was the type of a requirement and also infrastructure. But within a short time, the way number of technologies have been developed, and number of textile industries have been brought in, the fabric, the testing facilities, so many things which have been created, and many industries have been brought in, the types of PPEs which have been brought in. They went close to about 10 lakhs PPEs per day within a short span of about maybe a month. About a month, yes, it is so. Similarly, if you talk about very high technology systems, uh, like ventilators, high-end ventilators which are required in the ICU, if you look at it, um, there was nothing except one or two small private players doing some ventilators in the country, wherein the people have taken the endeavor and people work day and night and developed the ventilators and then mass produced them, all within a span of about 4 months. 30,000 high-end ventilators have been produced in the country. 30,000. 14th of August, Bharat Electronics Limited delivered to this nation 30,000 ventilators. And imagine the way, the pace at which has been designed, research, development, and production. And even though industries were closed, they were locked down, and people were not coming, and there were so many problems. Encountering all the problems and facing all the problems, there have been special arrangements have been made, and people have been brought in, industries have been opened, and materials have been brought in from outside the country, special aircrafts were made, and all that and have come. So, actually, what I'm trying to say there is, with respect to the last year experience, I'm not trying to get into many details. When you have decided that yes, you should do within this country, you should develop it in the country, then immediately you are able to take up and then you are able to produce, you are coming out without compromising on the anywhere on technical specifications or quality or anything, you are able to do it in the country. DRDO alone has come out with about 75 types of various products last year, 75 types. And about 125 industries have taken that TOTs and they have produced here, they have supplied outside the country and got it and all that and gone into it. So the inspiration, whatever got various people in the country, various industries in the country, try to develop many things on their own, and they have gone through it and all. Look at this year again. When you look at it, when this pandemic second wave has erupted here in the country, main problem in the country has been one is getting beds in the hospital, and second is oxygen. These were the major two issues. And look at again the way the country has responded, various state governments have responded, and the central government has driven various departments, and we ourselves, DRDO side, developed, built many hospitals in a very short span of time, created infrastructure like anything. In Delhi, 500 bedded ICU hospital, or in Ahmedabad, 800 bed hospital, or in Lucknow, 500 bed hospital, or Varanasi, 750 bedded hospital, or talking about giving the hand holding the state government near Bhopal or Panipat, are the hospitals which are built in Rishikesh or Haldwani, are being built in Jammu, are being built in Srinagar, are being built in Guwahati and Dibrugarh and all the places. Within a short span of each hospital with all the facilities which are required in any hospital along with the complete oxygen facility, in a span of about 12 to 15 days each hospital, and then making the people come up, and then armed forces in some of the hospitals coming up, taking the medical examination and other things, facilities is one important thing what country has taken. Similarly, on the other side, in the oxygen, one is the various empowered groups of secretaries working on how to make the oxygen available in the country, getting oxygen from outside the country, cooling up the oxygen which is there in the country with various industries, steel industries and all that, cooling up that, then getting various tankers from outside, cooling up the tankers which are there in the country, and both mobile tankers and stationary tankers, wherever you need stationary tankers, and within no time, actually doubling the capacity, which was about 4,000 metric tons or less than that, and making it almost 8,000 metric tons in a short span of time, and making available oxygen is one aspect. Second, same time, the capability what has been developed in DRDO for the fighter aircrafts like Tejas, an onboard oxygen generation system which has been developed, which actually uh, has been transferred to make a large volume of oxygen generation, like 1,000 liters per minute. 1,000 liters per minute type of an oxygen generation plants have been generated. And see that now the PM CARES has sanctioned almost about more than 1,000 such plants across the country, and industries have been brought in. Now, the way the industries have geared up today and started producing them, getting all these items, getting the design, getting the technical details, and getting onto the work, the, the plants started flowing out. I'm very confident this month itself, anything between 150 to 200 plants will be coming out in the month of May. And then the whole total 1,000 plants, out of which 849 are should be from DRDO. By July end, all these 849 plants will be able to uh, come out of the industry and will be going to the various locations and they will be getting installed there. This is another actually a mammoth exercise from nowhere, which the country was producing maybe 4 or 5 plants in a year or so. Now today talking about another smaller plants of 250 and 500 LPM. Also various industries are geared up and state governments are ordering. That also maybe another 1,000. So there will be about more than 2,000 oxygen generation plants of 1,000 liters per minute and 500 liters per minute and 250 liters per minute plants will be coming up in the next by end of July itself. This is the type of activity what has picked up in the country, and within no time the country has shown the agility and capability to come up with these plants and produce them in large numbers is another important thing what we need to do. Similarly, the shortage of cylinders and having the capability to automatically adjust the cylinder output to the person with reading the value of the SpO2 and then automatically regulate the oxygen, and then when the oxygen is being pumped in, how to save the oxygen when somebody inhales and exhales, trying to put in an NRV and try to have a rebreathable mask there so that you are saving the oxygen. These concepts have come, and people who have been using only manganese steel for producing the oxygen cylinders in the country shifted to aluminum without any weld in the extrusion mechanism. The forced extrusion mechanism technologies have been used, and people are coming out with daily thousands of cylinders. Every day, thousands of cylinders are coming, which will be again distributed all over the country. And everybody at home or home center, healthcare center, or quarantine centers, and various places, these cylinders can be used without much of disturbing or creating a trouble to the medical infrastructure and medical staff who are present there. This is another development. Similarly, one more development which has come in is the medicine which has come out of DRDO, the INMAS, which has been working for the last 15 years on the molecule, found that it may be very useful for this type of a virus. And since last, I think since April last year till this time, lots of studies and clinical trials as per the directions of DCGI, 1 year at about 35 to 40 hospitals across the country, over about 330 or 350 patients has been done exercise and found the results are good, and then DCGI gives an approval, and then now the drug is released in the market, and then trying to produce in quantities to make that it's available in the commercial market is the exercise which is going on. Again, in a very short span of time, all these exercises which are going on to make all these things available to the people who are suffering from this disease today in the country. No, once actually people started working a lot. I'm actually surprised my own scientists today have just released one more thing which has been approved both by ICMR and DCGI for antibodies testing. A new mechanism, a new method has been come out, and then technology has been come out, and then it has been given to industry. Just yesterday, it has been approved by DCGI, and industry will be coming out from 1st of June. They will be able to produce in numbers, and the testing of antibodies test can be done quickly at a very low price. Is one more technology which has come. See, how I am trying to say is the way the technologies have emerged in a short span of time, people have responded in the country. Today, I'm saying uh, trouble what the industries are facing, the lockdown, the people running away because of the pandemic, people afraid not coming to the industries, and then oxygen not available in the industry for the work. But then succumbing all these problems and still trying to deliver these numbers. Imagine such a 1,000 liters oxygen generation plants coming out almost about 20 to 30 a day. That is the type of systems which are being developed in the country. And I am sure that if we take up as a national goal and national mission, how to create the infrastructure, health infrastructure in the country, I think we should be able to soon develop it and give it to all the places in the country, all the hospitals in the country, and necessary infrastructure in the hospitals in the country, and then provide necessary all the equipment which are required in the country, and also in the rural areas. All that we should be able to create. That's the confidence I myself am getting looking into the type of development going on in the country with all the people coming together and trying to make the system. So I just wanted to tell you these developments. Probably most of the things you are aware of it, but then as directly looking after these activities, I thought I'll put forth before you. Hope it fits into the thought process of various speakers who are giving into it. Uh, Thank you very much once again giving me this opportunity, and I will sometime later, whenever there is an opportunity, I can little leisurely participate in this meeting. Thank you very much. Jai Hind. Namaskar.
Thank you, sir. Thank you, Dr. Reddy, for actually elaborating in very concrete terms as to what the government has done. And actually, the oxygen, the cylinder, that was key to the whole narrative in past 30 to 40 days. And that created the panic, and that was very much reflected on social media, because ultimately, with the new variant which spread in every part of this country, it was the issue of a bed with an oxygen cylinder, which was counting for the most, and which was actually leading to a lot of anxiety in a very collective way in the society at large. So thank you once again on touching on a very vital and important point. Yes, Mr. Verma, I would like to place a question to you before we can resume listening to three other esteemed guests who will be joining us. So I would like to ask you, in context of big hospitals, what was the thinking within the government that we will be able to take care of the second stage without those big infrastructures, which somehow got very close to when the second variant hits? What was the thinking? Was it a sort of a unexpected sort of a variant, which was beyond the pale of scientific imagination, or what?
Actually, I think the second wave took all of us by a great surprise. The reason was that the sutra, which was the basic instrument which was being used for prediction, that was not accurate, and that was not able to take into account all the variables, which is the reason why it more or less completely took the government and everybody else also, I think, by surprise. Actually, the private hospitals and the private sector in healthcare, it actually takes care of about 70% of the healthcare needs of the country. The government's share is only 30%, and that is something which we really need to look at, that we have to shore up and strengthen the government sector and see that primary healthcare is made available. And that is why I made certain suggestions with regard to primary healthcare. But at the moment, we see that it is the corporate hospitals and the private health sector, whatever it is, in the rural areas, it is the quacks which are meeting the need of the populace, which is again a very unhappy thing. It also needs to be looked at after the pandemic is over.
Okay. There's one more question which I really wanted to, reserve it to the last, but since Professor Ganguly is there with us, Professor Ganguly, can you hear me?
Yes, I can hear you.
Yes, Professor Ganguly, I really wanted to ask, because a lot of protocols are being changed. For example, HCQ remdesivir, plasma therapy, it is somehow affecting a lot of public confidence. What needs to be done? Public needs to be educated that, no medical protocol is eternal. It keeps on changing. How does the body of expert and expert knowledge interact with those who are actually afflicted with it, and may not be doctors, may not be, those high profile professionals who understand the world of medicine? What needs to be done to tell them that, it's okay if something is being discontinued?
Actually, all of these repurposed drug, the new drug discoveries are coming up. There is one sanitize, which is a nasal spray, which has done wonder, two protease inhibitors. But what we were using were all repurposed drugs. They were not made for COVID. And very quick trials were going on globally. So whenever one trial failed, a new one came. So what we need to do is communication, public communication and advocacy, telling them in their own language that why it has changed and whether it did any benefit or not, and be very transparent about that. Public will understand this. So it is nobody's fault. It was really changing around the globe. And but if there was something changing around the globe, we should also not persist with that, and we should quickly, that will build up the confidence. I will address one question which you asked, Mr. Lovarma, that infrastructure need. Actually, he's right that 70% is done by our private sector. The private sector health structure has collapsed because they also need to do with the cardiovascular, neurologic, accident, trauma, etc., and they were bleeding. So we need to really look at this infrastructure afresh. And one of the things which we need to do is build up infectious disease hospitals. Every district, every big metro, and every place. And tropical institute. We had a world-class tropical institute which has collapsed, which is in Calcutta. So we need to build up tropical disease institutes in major places in India, so that they can strengthen this infrastructure, and it will be distributed when such pandemic comes. Because once we have seen this, because if the very large number of people with cancer, with other things, they are not getting treatment. So we need to see that this doesn't happen again.
Before I go to other guests, Professor Ganguly, I just want to understand one more thing. You spoke about building infrastructure. Social medicine is also about public participation. If I'm not wrong, I'm not a medical expert. Social medicine is about public participation, and people do it in a lot of good faith. For example, when the whole issue of remdesivir came, people created infrastructure. Or for example, when there was an issue, a lot of politicians tried to import it. Or there was an injection, people try to organize it. So where is the balance between, how do we try not to over-create an infrastructure which may not be required after 2 months, and to ensure the repurposed drugs are there available, but not produced in a way which are not required after 6 months? Because the whole debate on remdesivir is actually on this, that now you have so much of it, and people say, what do we do with it?
Actually, here the planning failed. The Gilead gave 5-6 companies the formula. Our CRO started making the API, and CSR also funded some API things. So we had API, we had companies, we could make it. Suddenly, the demand went away from the remdesivir, and people returned remdesivir to companies. They stopped production. So when you again come back, it takes 23 days. So some or other, I was chairman of IPC. I found out a solution. I said that do a quick microbiological test and don't wait for 23 days. So production is back now. It is the distribution, one thing which we didn't discuss, the supply chains, inventory management and other, as it is done by Amazon, as it is done by major such things. We need to really strengthen that. And what I really concentrated, I will stop here because I have taken a lot of your time. What I concentrated on, that we have institutions. We need to strengthen these institutions so that they could do their jobs. That will be the best infrastructure development. We have the infrastructure. And what we didn't have, I just identified. We have drug companies, we have vaccine infrastructure, we have So what we said, that few things I said, that we need to have a supply chain and others, and we need to have a stockpile, and we need to bring few new structures, but strengthen our things. And last point, but Dr. Lavarma, Mr. Lavarma said that from where we get these. When I passed out from the hospital about 60 years back, I used to handle the entire ward there, entire ward. And Mr. Shekhar Datta also did that the GPs have disappeared from our country. Now the person who come out as MBBS, they can't do anything. They prepared for post-graduation. We need to put them back on work so that they learn the trade. So we have these, we need to put back the nursing students who are waiting for the examination back on work, so that they work and they benefit out of it, and we provide them benefit.
Okay, now I'll take the discussion to Dr. Dutt. Dr. Dutt, please explain it in a very layman way, because the whole country battled for oxygen. And there was a battle for oxygen in this country for 50 days. And you would have also seen the Twitter and the Facebook that instead of, calling government officials, there were, you had requests for people from the political frontal organization of a political party. And this is there on Twitter, this is there on Facebook, and people cutting across the parties were making requests to 4 or 5 people in New Delhi that the oxygen should be made available. I would like to know that, in terms of construction, steel making, cement making, areas where oxygen can be manufactured, or for example, later the decision was taken to reactivate Sterlite. What happened on the way? Where did we lose that we were not able to provide and rejig the logistics map so that the oxygen is provided to people? Somehow at that point of time, I personally felt that, when you say which country do you belong to, I said, we are a country we're going to be developed very soon. Developing, that's what you're taught in school textbooks. And I felt like a person living in a third world country where basic amenity was not available. That's the feeling I, as an individual privileged in New Delhi, felt.
You're right. Actually, we have to know where our friends are, where our likely places of concern are, and where our foes are. Now, India has one of the largest manufacturing ability of steel, of iron, and oxygen plants are dispersed in those. So, but they require time, because nobody has talked with them in order to get oxygen for the hospitals. Now, we should have the list of those kind of institutions where you can get certain things. Say, for example, there would be a requirement in case of large-scale, operations. You would require, glucose. Now, where do we can get glucose early and in large quantities? So we have to have those kind of things, and this is basically what Dr. Ganguly was saying: inventory planning, inventory management, and easier supply. And this can be done. What we did was knee-jerk, and a lot of things which ultimately came. And Dr. Reddy, DRDO, he pointed out, everybody knows that all the our Air Force jet, or the people working over there, and also in order to have the machinery working, require oxygen, and therefore the DRDO. Now DRDO came to rescue, and this. Then the second thing is that we have to have a proper regulation of that. This is for medicinal oxygen, and these are the organizations, and we require so much. Why should hospitals be hand to mouth? They should not be hand to mouth. They should be large numbers of oxygen, and they should be in a bus system, so that the oxygen cylinders which get empty are replaced with newer oxygen cylinder, but it's all in the bus, and so that you can give the patients of the ward wherever it is required, and this is a proper hospital management. You see the way AIMS or even RML and other hospitals are organized, they have all these things, and therefore they are organized 100 times better than many other hospitals where it is sporadic or wherever the need is required. So management of hospitals, management of the work centers are necessary, and of course a very good idea about the supply chain and the transportation of the supplies.
Okay. That's a very fair point you have made. Is Mr. Verma, you are there with me? Sula Verma?
Yes,
Okay.
very much so.
My question is because, generally when we discuss, not sometimes, often it becomes very urban centric, because we live in cities, we understand the issues of cities, Mumbai, Delhi, Calcutta, Bombay, it's like supply logistics. People understand that, that was the problem in terms of oxygen. Did our medical infrastructure, and I'm not asking in a rhetorical way, I'm asking the way any novice would ask you, did our medical infrastructure fare poor people in rural India?
No, you are absolutely correct. We have a very urban-centric approach to health. There's no doubt about it. And now when you open the TV channels and you see that people are being treated by quacks because there's no medical infrastructure available in the rural areas, then you realize the enormity of the problem. Well, as I said, I think this pandemic has brought the role of teleconsultation to the fore. And we need to now really look at it and strengthen that, because it has been a neglected part of our medical infrastructure for far too long. And I think that is where people in the rural areas can connect with medical experts and get proper medical advice.
But, this is one aspect of it. My question was in context of medicines. My question was in context of basic amenity like oxygen cylinders. My context was also in terms of dignity of body after death. If you die in a Delhi hospital, at least there's a mortuary for you. You can at least keep the body. I was personally aghast to see pictures which portrayed in social media across India that there was no dignity to the body after death. It really disturbed me, Mr. Verma, as an individual. You can't care for your death, you will always ignore your living.
I totally agree with you there, but that is because I think we took our eyes off the ball and we were totally taken by surprise by the enormity of the second wave of the pandemic. And when you're talking of oxygen cylinders, medicines, and other things which are not available even in the urban areas, so then what to talk of rural areas? In fact, I think what we need to do is to take a holistic approach and also look at the infrastructure we have in the Ayush setup. So there have been several attempts to train them and maybe have a bridge course, but this has always run up against entrenched lobbies, and even the courts have not taken very kindly to such attempts, with the result that so far our Ayush infrastructure has not been utilized to the extent possible. So that is one area I think where maybe after the pandemic, the states and the center needs to have a fresh look. And I'm hopeful that the judiciary will also, change its mindset after seeing the devastation wrought by the pandemic.
Professor Gangli, you wanted to come in, you raised your hand.
Supplement what Dr. Verma said. We were totally. I was saying that my span in medical field now runs to about 55 years. In my lifetime, I have never seen something like this. So we were taken a little, totally by surprise. However, one of the things I want to say, which you said, that there is no shortage of medicines and other things. We need to plan up, like for the black fungus, the liposomal amphotericin B. This was Dr. Vimal Bachawat's discovery, which Gilead then took and made it. And Gilead was giving it free to India for leishmania control. Four companies were making liposomal amphotericin B. So it is there. We need to see that, and they are making amphotericin B alone also, which is a little toxic. So there is no shortage actually. Here we need to plan in a way that these become available to our infrastructure. There is, at least for drugs in India, there could never be a shortage, because at least pharma companies can really make it something within few months. So there is no shortage for that.
Okay. Right now, I'm very happy to inform everyone that Dr. Jayalal, the president of Indian Medical Association, has joined us. So thank you very much for joining us in this webinar. But, there's one question which I'll come back to all of you, is that, there were enough hints in this country. It's not as if this is the first time the pandemic has taken place. 20 years with deforestation, this little epidemics were hitting. They were all originating from viruses. So they were epidemics, but this went on to become pandemic. But that's a different set of question. Dr. Lal, over to you on our webinar on rethinking Indian health infrastructure. I would like you to speak on this issue. Where do you think we faulted? What should be done now to correct? What should be our forward planning?
Yeah, thank you very much. And it is in the learned colleagues, I am able to be with you at this moment. Indian Medical Association is striving hard on this pandemic from the forefront to help the country to get over this crisis. We face a lot of challenges. I just heard Dr. Ganguly sir was telling about the medicine shortage and the shortage of the other infrastructures which is needed. But I am sure that all of us would have been aware of that. But one of the issue I just want to highlight at this moment is the planning for our manpower at these pandemic areas, where we get into trouble, because as there is a rapid increase in the cases, all this infrastructure or the apparent materials and medicine, we will be able to overcome it in a very short time. If we can either import or we can augment the production in the companies, we can divert the oxygen from the industrial use to the human use. So all this is relatively easy administrative skill. But one is the long-term planning, which we need to always do, is the sustainability of the manpower which is needed for the country to take care of the pandemic. Is there is any dearth of manpower? Absolutely no. We have enough. India is one country where we have producing enough number of doctors, enough number of paramedical people to tackle the healthcare workers. In average, we have 536 from medical colleges. We are getting nearly 86,000 doctors coming out of the medical college every year. That is a huge number. In fact, if you need to calculate in the overall era. And when we go, and especially when we look in the southern states of our country, and there the doctor-patient ratio is much below what was expected for WHO guidelines. That is, in Tamil Nadu, it is 536 patients has one doctor. And Kerala, it is almost 500 people have one doctor. So there is most of the countries we have enough doctors on that. But at the time of crucial appointment or the government, when most of the time the pandemic hits, the people are approaching the public health sector, but the infrastructure and the manpower at the public health sector, it's very dismissively poor. And today, when there is an entire hospital beds are converted into for the pandemic, we do not have enough manpower at this time to tackle. So this is one of the area where we would like to urge the government and other stakeholders to see to that. And we have to augment if at all we need to spend our public health as one of the common source of the combat pandemic or other epidemics in the country. We need to enforce and strengthen our public health. To strengthen the public health, first of all, we need the fund. That fund comes from the budgeting. But unfortunately, in India, the budget allocation for the public health is around 1.2 to 1.5%. But persistently, all the governments, when they are coming, their budget will not have anything more than 1.2 to 1% of the total GDP. But comparing the Western countries, you will see the UK spend nearly 16%, US spent almost that amount of money of the GDP for spend for the healthcare. So as there is no public health funding, and we are only temporarily going for some of the infrastructure building, but the most needed manpower planning is not done. And in India, at this crucial moment, for the last 3-4 months, we were insisting on that the manpower will to come. And if you look into the criteria now, 1.78 lakhs doctors, those who have completed their MBBS, waiting for the PG entrance examination to be conducted, And by that, they thought they are aiming for entering into the postgraduate course. 1.78 lakhs people have applied for that. So NEET PG exams are supposed to held at January. It was postponed, citing the reason as the COVID for the April 18. Now again it is postponed, and again it is postponed for another 4 months. So that makes this 1.78 people, that is one of the dream of anyone who is in the medical profession to get into the post-graduation, still continuing to prepare from their house and not coming out and joining the workforce of the country, because their aim and their ambition is only becoming at the post-graduation. If they are, for what you are coming to conduct the examination, if they are passing, they are going to come and serve in the COVID ward. And for electing people or recruiting people to work in a COVID ward, we are saying that COVID is the reason for not conducting the examination. And there is more than that, people are there available to come as a junior doctor. And very recently, if you see, the Himachal Pradesh government has announced invited the doctors to come and work for 100 rupees per day salary. And if you see some of the other states, they are putting 3,000 rupees salary. There is an UP state government has invited doctors to come, and they quoted the salary, which is on one hand for the MBBS doctor, it is 3,000 per month. But the hospital worker, when they come in the sweeper, they have 3,600 rupees as a quote. So we are citing that reason. We are not realizing the importance and realizing not ready to spend the money power to secure that the good manpower is not coming. And also we are faulting in our planning that we are not conducting adequate examination at appropriate time and getting into these people. So that resulted in, though we have enough doctors in this country, we are not having them at this moment to serve in the manpower in the sector of the healthcare sector. And we have lost 350 doctors in the last 1.5 months. That is a huge number. In this pandemic, we have lost 3,500. Totally, we have lost more than 1,250 doctors. And many of them, some of them has resigned their job. Some of them have even committed suicide. Such a kind of mental havoc we are getting in the hospitals. So my appeal, the first and foremost, for any industry to be success, there is 3 things they say: man, money, material. Money and material will come, but man will not come. So equally for the healthcare industry also, the man, money, material is the 3 important component for the hospital to go forward. But the manpower is the most important planning which we have to do, and how to incorporate them, motivate them, retain them, train them, and prepare them to face the endemic or the pandemic is the most important criteria we need to concentrate at this moment.
I think that was a very incisive presentation. But there's one issue, before we, before I move on, because Mr. Nimesh Desai is also about to join us. What I really want to understand, and the points you have already made in context of the forward planning, is that do you think that it's only reliant upon the infrastructure which is physical, or it is also reliant upon our ability to deal with a pandemic like this on the nature of research which is happening abroad, like for example on Ebola or H1N1, or the sort of research which is taking place in Africa on the viruses, or is just on the infrastructure that we need to be focused on?
Yeah, I fully agree with you on the research forefront, and the overall disaster planning has to be there. But this corona pandemic, which has proved that no geographical boundaries or whatever the environmental protection, whatever the barricade you have built so far is protecting enough to safeguard yourself. And whatever, even if you say that the foresting or deforesting or any other area where the infrastructure has done good, or all this has become poor. Even in US, we see there is the hospitals, the healthcare system was collapsed. And the healthcare system was not able to meet out to the challenges which was faced, because there was a death was happening rampant. In many Western countries, they faced that they were not able to stand across the corona pandemic. But what is more than it, I want to stress upon that is the research and everything should be focused on into building or empowering or recapping the ability of an individual, ability of the doctors to face the situation. For that, we need to even talk on our medical education system which we are having, and medical education administration pattern we are having. So medical education system talks about only the clinical component. It is not going to talk about your public health component and epidemiological pandemic component, and it is not preparing them on the administrative scale. And on the other hand, if you see our administrative sector, We have all known people who think that once you get an administrative service like IAS, they are the heroes and they know everything and they can plan everything. But this is one area where Indian Medical Association, we are repeatedly stressing upon, is the Indian medical graduate system, Indian medical administrative system. There's IMS, a cadre where the medical person who is empowered with medical knowledge, also an administrative knowledge, if he can come, he can be able to foresee the things, he will be able to plan, project what is going to come and prepare yourself according to that. Today, India, we have not seen how much drastically the second wave is coming. We were complacent. That is the one reason we have landed up in a trouble. So if we need, my focus will be more on empowering the manpower, empowering, equipping, and putting the right person at the right place is going to help us some more. I partially and correlatively agree that all other research or environmental, all other research is also going to play a major role on this.
Thank you. Dr. Nimesh Desai has joined us, Director of Institute of Human Behavior and Life Sciences. And I welcome you, sir, on this webinar on the issue of medical infrastructure. We are, we'll be dealing with issues like, what about the concept of, vaccination or pandemic health insurances. That's where a big hole is, because a lot of people end up spending their own money, sir. Our perspective of universal health coverage. But there's also one question, if you would like to address and speak on the issue, all these issues which you'll be addressing is, so when I landed in India in 2020 from Dubai, and there was a party at a very senior politician's place, former law minister, I will not take the name. So everyone there was discussing issues which had to do with the local election. And I was constantly using my sanitizer. So one of the very senior strategic experts said, why are you doing this? I said, I'm very afraid, in Dubai, they have cleared out all the hotels and they have put all the sanitizers and, this has broken out in Wuhan. But I'm very surprised that you are not talking about it, because I was there for 10, 15 days. And I suddenly realized that I have walked into a different political ecosystem, from a different ecosystem, which was far more aware, because in that ecosystem in Dubai, the rural's family had cancelled all the program. And when I was in India, it had no impact. So sometimes the threat or the cutting edge knowledge of what is happening at the frontier, travels very late. And by the time it travels to the point where it is required, the damage has been done.
Thank you, Karthikeyan. What I gather from your question prompts one or two thoughts of a much larger scenario. Let's visit quickly to flag all of them. Social sector issues like health or education have rarely figured at the priority or in the middle order of the polity of this country. One, only now recently it's beginning to do so, including what our friends from IMA is saying. Second, there is this whole issue of a democratic system vis-a-vis a closed benevolent monarchy or other totalitarian systems, and the difference is there. Third is the level of organization of a society. And fourth, most important, really, is I also don't entirely buy into this argument of merely lack of healthcare professionals in numbers or funding. While funding and number of healthcare professionals matter, I have in my career and lifetime seen enough examples in public health and mental health field where even with enough funds and human resource, the delivery of the health service is very deficient, if not worse. And so those are the 3 or 4 background factors. But if we get down to the current pandemic, I entirely see what you are saying, because for last few years, some of us were kind of carrying sanitizer packs in our bags or in our pockets, and people used to laugh at us. There isn't that awareness about one's own health or the community's health being dependent on one's own behavior, be it about hygiene and sanitation, be it about lifestyle, be it about a few other factors. Like I've been saying for the last 1 year and a little more, if there is one thing this pandemic should do for India, is the deeper realization that individuals, small groups, communities, and larger societies like us, our health status to a significant extent depends on our behavior. And I say that as a psychiatrist, as a mental health professional, as a public health professional, as a social scientist. 2020, somehow we were lucky with the higher physical immunity, better psychological resilience, and a few other factors, we kind of were lucky to get away easier. And most of us kind of celebrated. During Diwali and post Diwali period of 2020, there was enough concern, including some of us in public platforms, to say, look, let's be careful. We were not. So I'll keep coming back to in my first response to your set of questions. It's the all the other four background larger macro factors, but the relationship between health and behavior at every level, micro, meso, and macro.
Because you spoke on the issue of behavior, and you also spoke on the issue of urgency. There is an issue I would like you to
Sure.
address, and that
Sure.
is challenges faced by our healthcare workers today. One is that of technology and making it,
Sure.
making ensuring that they are well protected, and another is to ensure that they are out there. It's like they are the real soldiers. Soldiers are well protected in terms of war by weapons, but the generals train them, and the training is here. It's of the mind. So, can you address that issue of the challenges faced by our healthcare
Oh,
workers?
sure. Glad to. Again, one of my hobby horses, so to say. Two or three points that you touched in the same point. One, like our friend from IMA was saying, if I got that right, the entire medical education and medical education system is somewhere not at all well prepared, or nor does it prepare physicians or other healthcare professionals for the role that they need to execute in a number of ways. Again, very briefly to flag the issue of socio-behavioral factors in healthcare and what any one of us does. Much more importantly, the psychological preparedness, especially for crisis or disasters or epidemics, as you are addressing in last few questions. There are huge deficits in medical education in this country that are getting addressed, but very slowly, and it's still, frankly, I've been a part of that. And so I incriminate myself also when I say that. Our medical education system is near archaic. It's getting better, but it's nowhere near contemporary or 360 degrees holistic. But allow me to, since we are talking about health workers and their welfare, besides the systems issues, let me also address another issue that might or might not come up otherwise, and so I'll take this opportunity. I know that the Indian Medical Association national headquarters some time ago launched a helpline for healthcare workers, that I was remotely involved in. We have in Delhi, with 4 or 5 agencies coming together, launched in 8 months ago, a nationally available helpline for frontline workers and healthcare workers called Samarthan. We recognized very early that the stress and the problems that the healthcare workers and the other frontline workers go through should require support and counseling. Believe you me, and I'm really at some point dismayed to share this and yet candid enough to share this. The calls on that Samarthan helpline, 8 a.m. to 8 p.m., 6 days a week, Karthikeya, are very limited. Even in this second wave, would you believe that? Would you and the other colleagues believe that? Now, as a psychiatrist, as a public health professional, baffles me and my teams. But I have a couple of explanations, and one of them is relevant to what we're discussing. Somewhere the preparedness of healthcare professionals, including medical doctors, to be efficient, to be professional, and yet accept that one is as human as anybody else. You see, doctors and healthcare professionals have a serious problem for a number of positive and not so positive reasons, to accept that any one of us may also need help. And that's my major explanation for to my knowledge, all the nationally available helplines for healthcare professionals have low uptake. So on the one hand, informally and semi-formally, we keep coming across a lot of junior, younger colleagues and contemporary colleagues who will reach out and ask for help and just ventilate. When you have a semi-formal or formal mechanism, there's a huge hesitation beside the stigma. Mm-hmm. That's the demigod feeling that doctors have, the invincibility part of it. Besides, of course, the pure dedication. I also completely recognize that during this 1 year and last few weeks particularly, a lot of doctors and healthcare professionals have worked with such unbelievable dedication that they overlook or neglect looking at themselves or their own needs. And so that very basic dictum, care for the carers, be looked at by the system, by the society, but also by the carers themselves. That's the problem of the medical education, to me, it seems.
Okay, but this is something which I do understand, because the last time, as I again said, when I landed from Dubai to India, I must have received 60-70 calls about my well-being, though I got a test done.
Okay.
This time when the pandemic actually hit hard, the tele-operations completely collapsed all across India. There is no doubt about whether you call it trace and test or accounting system or managing people hotspots, it completely collapsed. But
a quick point, and then I will have to leave because somebody has died and I have to attend to that.
I'm so sorry to know about that.
So the 3 quick points. One, Dr. Nimesh Desai said the post-stress trauma which happens during this, and stigma which is actually hurting us, that need to be addressed. Research, you asked. Research, because I'm a researcher, so I want to address that. The polio was one very good example where our research actually drove the entire world, because we were having polio, others were not. So we did environmental screening, we did molecular epidemiology, we did world-class surveillance, we tracked it in the different parts of the world, and we controlled it, and people followed us. So research is the central part of this, and I actually agree with Dr. Jailal at this time. Our research need to be different at this given time so that it could be translated into action quickly. Finally, you talked about Mr. Verma, Love Verma ji, talked about federal structure. The federal structure is a strength and federal structure is a weakness. We need to rewrite our federal structure where we are able to perform better in the federal structure. 2 countries in our vicinity, Indonesia and we, have large countries with large federal structure. And this is a boon and this is a impediment also. So we need to rewrite this when we are looking at infrastructure development and see that we are able to function better in this.
Sir, was very helpful, and I want to share that before he leaves us. My condolences, sir. Early part of the previous decade, Gujarat earthquake and tsunami, with Dr. Ganguly's guidance from ICMR, we did tremendous research, NIMAS, IBAS, and ICMR in disaster mental health. And the NDMA took it up. So while I'm completely with Dr. Ganguly, sir, in the application of research and how we should lead, sadly, in behavioral and mental health aspects, to me it seems now, especially in 2021, that even available research is not being applied. And that's the sad part.
Okay.
There's tremendous research that Dr. Ganguly guided us in that period, IBAS, NIMANS, and ICMR teams, to have, and we have very robust research on epidemic and disaster-related behavioral mental health aspects, and yet somehow we are not able to apply that. I thought I must say that before Dr. Ganguly leaves us.
So I thank Dr. Shekhar Datta, Mr. Tikku, and all others, and it was a real treat. And I really appreciate this independent think tank, which has provided a lot of thoughts. Thank you.
But we will continue our discussion, and this question is for you, Dr. Dutt. There has been a lot of discussion on the issue of vaccine diplomacy. A lot of political criticism also came way that our vaccines went abroad, and you would also know that America, Britain, a couple of other European countries, including Israel, they were able to corner a lot of vaccines, 70% of the global vaccines by the time the tenders went in. Can you shed light? Was it wrong on our part to commit vaccines, or should we have behaved like the Americans, just to sit pretty on everything which the world required and perform worst form of vaccine nationalism, if I may use the word, which Israel and Americans demonstrated? What would have been the way out?
I don't think that the idea of putting vaccines to some of the needing countries was a bad idea. We should have at the same time ramped up production, and we have the ability to ramp productions, like what you must have noticed now that Covaxin, they are making their production in 2 or 3 different states. So this kind of a thing last year could have been done, and it's a question of arithmetic. How many people have to be given doses, and the doses have to be twice, 2 times, and it has to be within so many days. Okay, fine, 6 to 8 weeks. So within 8 weeks, 2 doses have to be given, and that kind of a thing. So this is a calculation, and how much you can make, and how much. So how do you ramp up the things? Ramping up, it's an industry. It's a ability which India has very good capacity, and we have this. And of course, we took Sputnik, and also we are going to produce Sputnik. Now, what I'm saying is that India has always been in the forefront for manufacturing vaccine. Even much earlier, Hopkins Research Institute, we were making vaccines. We made vaccines during the AIDS, this thing, during the bird flu time. We at a very short notice made the vaccines. So we have the capability, we have the scientists, we have the scientific organizations, and we have the production center. The question is that, all right, give firm orders, give large scale orders, and here the perhaps the orders should have been placed last year, well in time, so that our vaccine manufacturing organizations can.
I think that's a very, very valid point, because if there would have been more vaccination, we could have remained committed to vaccine diplomacy, and we wouldn't have found ourselves in the devil in the deep sea. Because wherever the vaccines have been stocked, you'll find Russians and the Chinese openly coming out with their vaccines, impacting our diplomatic initiative, which is, for example, Bangladesh, and I know it complicates a lot of outreach issues for us. I completely agree with you in context of the production of vaccine. But one more question to you. We haven't addressed the issue of health insurance for poor people during the time of pandemic. Do you think, Doctor, that we require a special focus, a special white paper on this issue?
I think so, because the health insurance for other purposes are there, and pandemic is certainly. But I think, insurance doesn't take care of the hospitalization or the hospitalization. We have to ramp up our hospitals. We have to have. And like I said earlier, health has to be treated as an investment. We have to give, I fully agree with Dr. Jailal, that we have to give the importance doctors have in this society. Which discipline you have where it takes minimum 7 years to become a basic doctor, and then for another 3 years to become a specialist. And yet, if you see the way the career growth path is, they have to stay a very long time as an assistant surgeon or something, and their counterparts in, say, excise department becomes joint director or becomes so here is a very learned person to whom we confide our own health, and there we don't treat him well. But I think we have to, in India, you should see any other country, and this person, you in fact saw in the Gulf countries, the importance they give to the doctors. And we have to have in the Samaj a special position for our doctors. And I can assure you, I've seen the hospitals, I've seen doctors in all the places, and I found that many doctors are such who are worshipped by the local villagers, and we have to give them. We have to make their workstations good, and if that is there, then people are not going to die in COVID, because they will get physical and mental treatment straight away in the first level itself. So they will not be hospitalized.
Okay, that's a very, very relevant point. And now I would like to open the floor to the audience. I think Mr. Harjeet Sandhu has been making a point, and and Mr. Prince V. Shukla. There are two people. Mr. Harjeet Sandhu.
Good. The question, of course, in between, I did make interventions. First, I congratulate everyone for making excellent presentations. Of course, some we all know, but especially impressive. Mr. Shekhar Datta started very well, so obviously others had to follow it. And then Dr. Nimesh Desai was in and out, and I was looking forward to seeing him if he looks like the same whom I met in '93 in AIMS. So my point is just one only, because we have here Indian Medical Association people and some retired Professor Ganguly and all stalwarts. But I don't see officially anybody condemning this. Somebody did mention that these quacks are treating people and all. Quacks treating is one thing. But when our important people are talking of Gaumutra and Gobar ka lep on the body, I don't see any official statement coming out from any of the medical associations telling people that this is nonsense. I put it in the comments also as a question, but I think no one picked it up. Is there any one official position or any of these medical associations willing to comment on that? Is there any action being taken? Thank you.
Thank you for this
I will.
very important question which you have raised. And in fact, Indian Medical Association has already given a press release on the cow dung and other materials used. We are not against faith healing or people adopting to the faith. But in the pandemic like this situation, it is mandatory. The government should come out officially stating and what are the steps to be taken. The modern edition is concerned, ICMR or the government of India is coming out with a standardized protocol to say that this is what you have to follow. Because we believe in the evidence, we believe in the science, and it can be changed. And what we are saying is right was yesterday may not be true today. So that official platform is there. Unfortunately, in our country now today, neither the Ayush system or the Ministry of Health is not taking that in a positive way. And when the comments are made, they say that it is infringement on their faith or indictment on their belief. Or there is they create it artificially as modern medicine versus Ayush system fight. So that is one reason it is happening there. And today it was, this August body, I must admit, Baba Ramdev ji have said, if there is so much of people have died, it is only because of allopathy. I know 1 lakh people have died, but he forgotten to use that is nearly another 2.5 crores people were saved by the modern medicine. That kind, and he get an applause that is getting in all the media, and that is going out in a big way in the media, so that people are losing the faith and confidence, and they are going to the unscientific means and getting into trouble. And Indian Medical Association is going to take this matter to the Supreme Court. We are now filing a case there. Because we want what we are not against any system, we are not against any party, because all our system is good in this world. But somebody should not cheat the public with gimmicks or these mantras where we are going to get, people are going to get affected, people get the confidence that if I take that, I will be going to cure. And that is the one reason how this cycle of propagation of this disease is going on. I think the learned colleagues and the out of the box thinkers should come out with some solution. How will we go to the scientifically make it true? Only the sense of this, what is that wrong, or when these people are saying such a wrong things, or appropriately projected to the people and they take in the right sector. But it is a horrible situation we are facing today.
Yes, Prince, Mr. Prince, you can ask a question.
Hello, sir.
Yes.
First of all, thank you so much for all your wonderful talk, and it was all knowledgeable, full talk you were giving. My question to Jailal, sir, for you it is, what is expectation from the administration part or the management part of the healthcare infrastructure, and in this pandemic where we are lacking as a administration or a management part? Thank you, sir.
Yeah, my only observation is this management of pandemic has to be done on the war front in the front line. We cannot take decisions from the cold, AC rooms and take a decision which has to be done on 1 week or 2 weeks apart. It changes. It has to be taken in a comprehensive and collective way, and somebody should be there to lead the country from the front. And it can be prime minister, it can be health minister, or somebody who is designated. But where we are lacking today is there is nobody, whether with a medical person or the administrative head, is coming out and this is what tomorrow, what is our plan of action. People are trying to say that this is how much people died, how much people projected, that is there. But this is what we are going to do for the next 2-3 days. Oxygen shortage, yes, it is there, and we are going to do, these are the plan. Please do not worry, and you will get an oxygen. Remdesivir is a problem. Today, amphotericin is a problem. We do not have an amphotericin in this country. And if the ministry comes and say, people do not worry, we are taking all efforts from the night, importing, manufacturing, augmenting production. So that kind of system we are lacking. That kind of tick for tat or face-to-face challenging is not there, and it is only taking a back room, a comfortable position where we are saying that we have vaccinated 18.4 million. So that is a statement which is coming. That everybody knows. Statistic, everybody knows. We do not want a statistic. What we want is for the rest of the people are not getting vaccinated, what is the step we are going to do? If that kind of action is coming, that will be the good for the country.
Mr. Khurana, if I am not wrong, you wanted to ask a question. You had raised your hand.
Yes, I wanted to ask the question.
Yes, please go
I
ahead.
agree with Mr. John Ross, what is the statement he gave right now. My main question was to Dr. Shekhar Dutt. That what I feel, there has been total failure on the part of administration and political leadership. Administration has not been able to assess and make a plan to how to counter that. And what is happening is trampling by the high courts and the Supreme Court. Now the Supreme Court is because, what are the methods we are going to take to see that this type of authority, was Mr. John Rose has also said, this a failure is there on the top. What are the precautions we are going to take? Like an NDA, NDA is not equipped to take the care of the medical. I've been a part of NDA. NDA is not equipped to take care of the medical disaster. So what is we are going to do? And this is not the one time. No, epidemic is not the one time affair. Everybody is saying, Fauci is saying, everybody is saying it is going to be frequent, maybe every 10 years. So what are the precautions we are taking? NDA, we have taken the precautions. NDMA had come on the early of disasters had happened. Now this disaster is there. We should start planning and doing something.
Okay, Mr. Khurana, so your question, I got your question. Mr. Dutt, the question is that what is this response, what is the preparedness which is required?
Yeah.
Because we feel that the political establishment is completely failed.
I think it's a great learning.
Third wave is there. What is our response?
What's the response?
What we have assessed. I don't know what we have assessed.
Your response, Mr. Dutt?
No, I think it's a great opportunity for all levels of administration to ensure that what in the initial stages of this third wave, the difficulties that we have found, those difficulties should be isolated and step by step should be mitigated.
Correct.
So that is what is being done, and even those departments or organizations which are not in the forefront of providing health facilities like DRDO coming out with oxygen or coming out with the drug, and all the others, the private manufacturers of vaccines, everybody is now ramping up. The question was that in a period of say between February to April of this year, the shortages were enormous, and they have created a bit of not only a bit, enormous difficulties. And that's why I said that we have to have a health infrastructure which is much more distributed, length of breadth of the country, so that it can take care of the of such pandemic if and when it arises.
Okay, because Amitesh, you had raised your hand. Quickly ask your question, because we'll be joined by Dr. Rashna from Artemis Hospital very soon. So please quickly ask your question.
My question is basically the timeline which has been increased for vaccines, the people who have taken the first dose from 25 days to around 85 days. What is the real reason behind that?
Okay. Basically, I would say it is research and part speculation whether we have run out of vaccines.
Okay. Before I move to Dr. Rachna, can someone actually address this issue in a minute's time so that his question can be answered?
Hi, I'm Dr. Vinny Kantru. I am
Okay.
a pulmonary and a critical care physician actually.
Sure, please go
So
ahead.
the reason there has been an increase in the duration of vaccination doses between the two doses which people have to take are few flaws in the studies. They feel that there was a better response in terms of neutralizing antibodies which were produced inside the body after the duration in case of a field was increased. So there is a scientific reason why this duration has been increased. In addition, I would like to reiterate that the vaccines at the moment are in their preliminary stages. These are just the first generation vaccines. And we are all in the learning phase in terms of pathophysiology and also in terms of the vaccines which are being manufactured. These vaccines need to be upgraded, keeping in view the new strains which might come in and prop in and create problems. So yes, in research it was seen the later you give, the better it is. But in future, I would also like to tell that there may be a stage where we would say that maybe no other booster is needed in terms of having two doses. So at the moment, the best research is that increase the interval between two doses of COVID.
Okay. Okay, thank you, and thank you very much for pitching in. I really appreciate that you pitched in because the question was asked in such sincerity. Now I'm also joined by Dr. Rachna Khanna Singh. Madam, thank you for joining us. Thank you very much for sharing the precious time. She's head of Department of Holistic Medicine for Artemis Hospital, and she's also takes care of the stress management. She's a stress management expert also, apart from being the HOD. We were discussing here before you came the expectations from our medical infrastructure, the challenges it faces today, the sort of policy requirement which is required, what happened. So if you can just briefly sum it up for us, what were the challenges we faced and what are the challenges we will be facing in the future?
Yeah. So we are only from the perspective of mental health. Yes, we are facing a large amount of challenge because as as all of us are aware that it's a very tough time for all of us. What was in the first wave and what is now is a very different mindset altogether. There is a lot of disappointment currently, and there's a lot of despair in the environment, and there is also most definitely fear gripping everybody, right? With that, I'm sure all the mental health people sitting here would agree that our phones are not stopping to buzz because it's a difficult, challenging time. And in fact, we are soon enough now reading about the therapist burnout also because of the fact that in the last few months it's been a very difficult and challenging time for the entire population with us having to counsel for grief counseling and as well as even along with survivor issues that there are the issues are just non-stop. So people our patients who already were having anxiety and depression, their scales are soaring up. People who've never faced anything like this, they are feeling uncomfortable. So it's a difficult environment altogether. So it's definitely challenging, and I think with if we were to have more mental wellness, mental health experts, things would be a little different. And another thing is, I feel that I have a lot of students reaching out because of the confined situation for the last year. They've been closed indoors, small little kids who've not gone to the playgrounds for a long time to expend their energy fruitfully. Other teenagers banging doors at home, not knowing what to do because they're not able to reach out to the peer group, and consequently the parents are getting very, very disturbed because we also do not know when this is going to end. That's the part which we all don't know. The 12th grade students haven't gone the entire year to school, and they'll never get to say their goodbyes to their friends and their teachers physically. They never go back to see their school again. Kids who don't know exams are happening, no exams, college exams have got postponed. So it seems that there is obviously, besides the grief which all of us, I think, are facing. Everybody has lost somebody or the other, near and dear ones. Minutes you pick up your phone, you open the television, there's only negative news flowing in, right? So it is, I think this is a time when we also need a lot of peer leaders. And that's where I was coming to, besides the mental wellness and mental health experts, the psychiatrists, the psychologists who are all available. And I see Dr. Nimish sir sitting here, right here. Good evening, sir. And I would just say that, I think if we were to get some peer leaders, so I did just day before I was addressing all the principals of the CBSE schools of South District in Delhi. And, they all came up with this fantastic idea as well, that, to create some peer leaders where the kids can speak to their own peer leader, because right now it's like I said, the environment is so difficult and everybody may not have the capacity to reach out to a mental wellness expert, so or a mental health professional. So these are some of the challenges. Of course, earlier in the first wave, if you were to ask me, I would say we were still facing a lot of destigmatization of mental health, and I think that has definitely gone down. The stigma has definitely gone down. And I used to always say that, I wish somebody would, how easily people would turn around and introduce their nutritionist to everybody. If you were to meet people socially, I'd say I wish people would introduce the therapists also so easily, and they have started doing it, because they have started to see what a world of a difference it is to for our mental health to be given prime importance. So mind, body, spirit, soul, we cannot keep it apart at all. And I think everybody at this time needs to come hand in hand together. We're not only talking about mind, body, spirit dimension, we're also talking of all the other 6 dimensions of wellness today. We're talking about the environmental, we're talking about the society dimension, we're also talking about all these dimensions to make sure that we all are holistically rounded individuals. And thereby today there is so much of voluntary work which is going in. So thereby I would actually say that one thing, besides, of course, we can't suddenly create a whole layer of mental health professionals. What we can do is kind of put our hands together and join hands together with a lot of the voluntary organizations which are coming in, teach them, train them, at least at a peer level. We can do we could train them by a train the trainer program, and I am doing that as well for even in the community in the RWAs, because at least to reach out and talk to us. A lot of the mental health professionals would agree with me that there are lots of people who are stuck in different countries, different cities, without their families, sitting back alone, not knowing who to reach out to, and with the constant negative autosuggestion of the negative news flowing in. So that is something which we all need to learn how to manage.
I think that's an important point you have made, because COVID is not only about physical issues. It can really create a lonely, desolate world. The parks are not going to be parks again. The world is not going to be same again. For children also, it's parks have been closed. The public spaces are being redefined. Now people are saying that even if you're in your colony, which used to be a safe space, I don't see even children moving out in my colony. The whole colony used to be full of noises of children, but it's the desolation of the place, and to have childhood being affected. I absolutely agree with you. My question is that generally people have been thinking in COVID from pure hard medical perspective, black fungus, white fungus, long COVID syndromes. But COVID in context of anxiety, loneliness, lack of touch, how does one repurpose and reorient oneself without losing the idea of intimacy, which is so central to human existence? What makes us human, men and women, is our ability to empathize, touch, feel. In the world where touch has become such a precious thing, where do we locate our society, our children, our civilization?
I'm so glad you flagged that after Rachna's comments. First of all, what you are asking will require another discussion, but briefly to say, and I don't know if it came up before I joined, but I have believed since February or March 2020 that this term social distancing is a huge misnomer and has done a disservice. What was required to be said was physical distancing. And I've tried saying this since March 2020 on record many places, that indeed the dictum is maintain physical distance, make sure you have emotional proximity and social bonding, even if it is through virtual means. So that's one part of the answer to your question, though. But I'm so glad Rasna made all the points that she made, because of from there, and I think she and I think on this like a few other things. All through 2020, I genuinely believe and kept saying on various platforms that the issue of mental health epidemic following this epidemic is actually overstated. If at all there was anything that seemed possible in 2020, universal psychological distress, but not really a mental health epidemic. Unfortunately, and there are a lot of reasons why I believe that based on science. But unfortunately, last few weeks have changed that. I now do believe that we have a mental health epidemic looming. And everything that you have not said, I would support completely. But I want to connect that, Karthikeya, with what you were saying. Unfortunately, this schism between physical and psychological aspects still remains. And let me give you a slightly different example from disaster. Like a lot of colleagues were saying, NDMA has worked well, NDRF works beautifully in physical disasters. Somehow there was no coordinated mechanism for the psychological distress and the social anxiety and everything that we went through in the last few weeks. And then I also want to make a larger point as a disaster health expert. See, one thing that science has taught us in last at least 30 or 40 years, and India has learned in last 25 years, is the need for a well-coordinated response in disasters and epidemics. And it seemed that in 2020, we had it under control. But that's no big deal because mostly things were going well. That entire thing has failed. And I say this with the fullest regret and responsibility both. Coordinated response has been almost missing in the country and in Delhi, even national capital. Should it be from the executive? Should it be from the judiciary? Preferably from the executive. But see, everybody is doing everything. In a coordinated response system, epidemic, you really need to have allocated tasks, avoid duplication, make sure they're integrated. That is just not happening. And that's partly because of that schism between physical and psychological issues. But I would still say, lastly, the only option humanity has, India has, and we have as a society is, and I'm with Rasna there, to maintain hope, faith, positivity, and take action in the psychological field.
Okay. And I'll be a little selfish here because, Dr. Chotani has joined us from United States of America. He's a world-class epidemiologist, and I'll be slightly selfish because he's part of the second session. But since I see you here now on my screen, I would like to take closing comments from you. You can have your fill in the second session, but this session was about the medical infrastructure. So you would allow this bit of little cheating that, since I see you here, you can give me a closing comment and as to how do you see this narrative of infrastructure panning out in India and what needs to be done.
So first of all, let me thank you, Mr. Sharma, as well as Adile, for me to be on this call. And this meeting. It's a definite pleasure. First of all, in terms of what you're talking about, some of the stuff that I was able to hear right now was the discussion of the infrastructure in terms of coordinated response, in terms of psychological issues that are going to be our population is facing, and everything else related to that. One of the biggest issues that I have seen sitting where I sit in the United States. Today, I'm in Florida, at Fort Lauderdale, because I'm working on some vaccine efforts over here. I go across the country, and then I have been observing what is going on in India. One of the most important things that we need to, as peers, as healthcare providers, as public health professionals, need to focus on is to find a solution, right? What is the solution? At this particular point, India is facing a humanitarian crisis. In all honesty, humanitarian crisis meaning the disease is spreading so quickly, so fast. It's just unbelievable. All of you know the numbers, so I don't have to go into the numbers. But India, on Wednesday had 4,500 deaths, which breaks a record. Unfortunately, the global record of deaths, which is just devastating. Just a few. On May 6th, India had the largest number of cases ever reported in a country. So there are lots of things that we have to learn from all of that. One of the most important things that we have to learn is that and on top of that, India is one of the largest manufacturers of vaccines, right, in the world, essentially. So, putting all of those pieces together, thinking about the largest democracy in the world, looking at all of that, what is missing? Why did all of this happen? Why are people facing this crisis right now, which is affecting all of them? It is just devastating to even think about it. But one of the critical things that we have learned, right, is that infrastructure, investment in public health, investment in preparedness is critical. And perhaps that is where the lag was and lack is. And one of the other critical things, which I was going to talk about when I was going to start my session, we'll do that because I think one of the most important things is to have questions answered. When you have just for all of you, a question: if you need to get dental surgery done, do you go to a neurosurgeon? The answer is no. When you have an epidemic, who should be leading? People who have knowledge in infectious diseases. The infectious disease epidemiologist should be leading this effort. And unfortunately, not just in India, in many parts of the world, even in developing or developed countries, the problem that I saw and I continue to see is that the infectious disease epidemiologists who know what this disease is about, who have seen that, are not being put on top, working in conjunction with the top virologists in the country. Those are the two critical pieces that are missing, and those are the people that look at data, they look at virology, and then they can come up with a better solution than what we have today. But if you have individuals who are not really experts in the field making decisions, then we will have calamities. One of the things from a psychological perspective that was discussed, from the school perspective that was discussed, the kids not going to school and schools and all that. Now, in the United States, we have 6 children. Which sounds like nobody in the United States has 6 children. I'm probably from Pakistan or India, and living in a rural community, but we have. And, we were affected by COVID. My kids were taking classes from home, and they continue to do so still at this particular point because everything is not open. But one of the things that I've observed, this is just observation, that because of the availability of internet, availability of having access to communication through that medium, there's a different breed of generation that is coming out now. Things have changed. But one of the things that I noted was that it was not that the kids were adapted to this thing much easier and much better than adults. Adults wanted to go out and have some fun because they miss their friends, they miss their peer groups. But kids were able to communicate and connect if internet was available to them, and they were not as affected, I think, as we thought. The other thing that this is anecdotal data, but having talked to all my friends, I have maybe about 40 friends who are psychiatrists in the United States. And, I constantly talk to them and try to figure out, has the number of cases in terms of psychological issues increased? And surprisingly, it has not. People are doing fine. So, we as human beings are extremely adaptive. We adapt to whatever the situation and circumstance is. And, that is something that I just wanted to make sure that everybody heard that yes, there will be issues, there will be problems, but the thing is, get over those problems. Right now, what is the problem? The problem is that India is facing a humanitarian crisis. Supplies are not there. The disease is spreading extremely rapidly, The numbers have gone down, but deaths are increasing, and we all know that deaths increase 2 weeks after the peak of the cases.
Okay.
They continue, and the deaths will continue more and more because the healthcare infrastructure is not there. Investments have not been made to develop the healthcare infrastructure.
Okay.
One of the biggest problems was, and still is, in New Delhi and in other parts of India where I have friends and I communicate with them.
Contrary views are very, very important, and I would say they enrich the decision. But something time will, and the data and the studies will decide whether children are more affected or the adults were affected. But I would say that it requires more study. It's like COVID syndrome, the loss or the lack of intimacy, or the word I use, the touch, is something very, very important. That's something so central to human civilization, to shake hand, to hug people, and that's missing. I miss shaking hands with my friends in office. I'm sitting in office today working. It's so I would like to thank everyone here for such a brilliant, deeply enriching and incisive discussion on issues of medical infrastructure. And I'm very happy that we were able to touch upon certain eclectic, or I would say that certain broad themes which are not discussed, like behavioral sciences, or for example, as Dr. Dutt spoke about the issue of vaccine diplomacy, which I thought was very, very important. And we also had the chief of DRDO who spoke on the issue of oxygen. And then lastly, I would like to thank Aditya, to you, for ensuring that the panel is there and the sort of hard work you have put in, Aditya. So thank you to you.
Thank you, Kartikeya Sharma sir, for being there and for being the chair. And the session was really amazing. In fact, I would like to thank all the speakers, all the honorable speakers, for sharing their knowledge and such a great discussion. I would just like to sum up what the speakers had said. So, as Shekhar Dutt sir mentioned, that there is a need for every individual to be very healthy, to have a good health. Also, sir, you mentioned about the equitable distribution of health infrastructure, and which I think is very important. As Professor N.K. Ganguly sir mentioned, also made a strong point when he elaborated on the need for physical infrastructure. Love Verma sir had elaborated on the need and significance of utilizing the centralized health structure of India. Dr. G. Satish Reddy sir mentioned about the potential manufacturing capabilities of India. And as he said that when the need arose at that time, all the major institutions, they came together and they are able to now fulfill the requirement or the demands of the country. I would also like to thank Jailal sir for mentioning the need for manpower planning. Dr. Nimesh Desai sir, thank you for telling us that how the medical system, education system needs to be improved. And Dr. Rashna Khanna ma'am, thank you. And it was really enriching to know about the 6 dimensions of wellness. And I hope that everybody would be able to look into them. With this address, we come to the end of this session. So we have a few people, but I would like to thank you all for being with us in this session. Thank you. Thank you, everyone.